What if I were to tell you that there's an approach to health that could help you understand the why? So that's kind of the big question that we have sometimes is like, wait, why do I feel this way? Why do I have these symptoms? Why is this specific condition here? And I'm going to start with a little bit of story about myself. I grew up interested in medicine, interested in the science of the body, fascinated by terms, conditions, and I was kind of enamored with the marrying of science and then the humanistic component of medicine, where you can actually meet people and be with them and hear their fears and concerns. And that happened to me when I was young. Is I had an experience in high school where I was waking up at 5 a.m. and going to the gym and then having practice and having PE and doing student body council and doing church stuff. And one morning I got up to go read scriptures to my family, and all of a sudden I fainted. I fainted and like had an accident. I didn't even know what happened and just like accident wet myself. And I was like, my parents were like, what was going on? Well, we had neighbors that were doctors and they came over and were able to help me and look through certain things and make sure I was okay. And that hit me super deep, where someone's able to be there for you in a time of need. And that was like, I want to do that for someone else. So that's kind of the initiation of medicine. Going through medical school was fun and great, and I learned a lot. But during residency, I had an accident, a surfing accident, as I was preparing for an Ironman. And I was like, I need to do something to help this. All they've given me is stitches and said, you should heal soon. And I was like, there's got to be more. Like, why? Why can I, like, why did this, not why did it happen, but what is it that's in this injury that I can help speed up, that I can help cultivate actual healing? And I came across Michael Greger, which has a book called How Not to Die. I know, kind of a stark, stark name, but um, it talked about all these other lifestyle factors we can do to improve our health. And I was like, I've got to learn about this. And so I later got board certified in lifestyle medicine, which I'll talk more about. And then there was still even a little more why. Well, what is this with mold toxicity? What is this? There's deeper stuff with hormones. Western medicine doesn't talk about that. And so my journey has led me to functional medicine. And now the question is what is your journey? What has led you to where you are today? And and that's kind of like where we are. Western medicine has some great things. And some of those things that Western medicine does really well is acute conditions. I mean, if you have, your arm broken and it's, sticking out, sticking out of your bone sticking out, then they're able to do that really well. And I'm going to put MD here. Surgeries. What about like obesity? We can fix that. We can cut your stomach and have half of the volume in there. We can fix that. Like, there's very good at acute things. It has a place. I'm a medical doctor. I would definitely be remiss if I didn't say it definitely has a place. But I'm going to say this is acute. But what about chronic? What about these conditions that are long lasting? There's individuals that come to my clinic and they say, listen, I have this condition, let's say low T. I have this condition, my hormone imbalance. This is long going. And there's this acute reaction physicians have. Well, I've got a name for that and I've got a drug for that. Let's a little bit of education maybe, and I'll see you back. Acute responses don't work for chronic conditions. And here is where we need balance. And here's where you are. This is you. And individuals look for balance. And when you can balance the acute and the chronic, you get medical doctor and you get functional medicine. And that's part of kind of how I see things, is like you have a chronic issue. And now I'm going to get into kind of an analogy. I teach with analogies because like it's how my brain works, and I think it's funner that way. Um, if there's any questions with this, drop it in the chat. But this is kind of like, that's the gap. This is where we are right now. What's the gap? We're really good at doing acute stuff. chronic stuff, struggling, a little difficult, right? So I'm going to draw a little fun picture for you. Well, I think it's fun. And this is scenery. These are two mountains. These are great mountains here. Um, oh, I got ahead of myself, you guys. We're going to come back to the mountain. We're going to go to the tree. Okay. So here's this tree, this weeping willow, and we've got a couple branches here. All right. Beautiful foliage. And on this tree, there are multiple opportunities to like grow. Okay. And this is kind of like the functional medicine approach. So we are this tree. What is unique about trees? Every single tree is different. Every snowflake is different. You even get like every salt granule. There's all these different things on Earth that are different. Well, every human is different. And that's one thing we learn in functional medicine with chronic conditions. And what we see here, we see our DNA. This is a DNA strand. Our DNA makes up the tree. What else makes up the tree? Our environment. I always do sunshines. I love it. Okay. I'm going to do a little squirrel here. Okay. My squirrels kind of turn into look like dinosaurs, but this is a little T-Rex squirrel. What else makes up a tree? We have what's around us. We have birds. We have the DNA expression. We also have sometimes outside influences, and I'm going to say this is a toxin. Someone's dumping, a toxin into the soil. All these things affect the tree. And you also recognize I'm missing something, right? Here's the ground. Here's these roots. I'm not going to go too much in the medical, like the Western medicine. I think we've got that. But some key principles of functional medicine is one, it is individualized. We see individual trees for who they are and where they are. Number two is a systems biology approach. There's an interconnected web that is influencing this tree's growth. Okay. And we may say, wow, look, these leaves right here are kind of withering a little bit. What's going on? Sure, Western medicine might say, well, let's just chop off that branch, then it's fine. We're not going to see those dead leaves. Well, functional medicine, we look to the root cause, we see, hey, there's some toxins going into this root area, and this root area supplies this specific branch. There's a systems biology, and I'm going to get into that a little bit more. Also, the gene environment. And this is what's really cool. I did some studies in medical school with rats, and we actually animal studies, and we had approval for this, but we would actually go in stereotactically. We would maybe I shouldn't get too like specific here, but we would like put their heads in this little specific plate, and we'd get a very specific part of the brain, and we would induce a stroke in that specific area. Okay, and with male, female rats, and we would look at gene expression. The DNA is the architectural print, but the expression is how the builders actually make it. That's how our body is. When the human genome was made, we thought, hey, we're going to be able to understand all disease. We're going to be able to understand all genetic expression when we figure out the genome. Well, we uncoded the genome and said, here's the genes, but how do we express those genes? And that is from our environment, how we think, who we interact with, our hormones, our time of life, the food we ate, huge. Environments and toxins and other types of factors. That is kind of the gene environment interaction. And I don't like this gun analogy, I'm going to use it. The genes are like loading the gun, but our environment and lifestyle factors are like pulling the trigger. And that's where sometimes we get these diseases, and we need to look at this huge functional medicine approach. So now let's get into the beautiful, let's get into that mountain, okay? So you might ask, so there's functional medicine. That's how we take an individualized approach, and we look at a lot of different things with extensive labs. And so what does this look like, okay? Henderson, if I were to come into your clinic, what would this look like? And I'm going to draw my sunshine. Got to always have the sun, good symbolism there. And I've got this path here that kind of comes up. here's a person. I've got so what happens is when someone chooses to meet with a functional medicine doctor, we start from the beginning of that trail. Hey, what was your mom's health when you were, in utero, when you were in her belly? How was her health? And we ask and learn questions along this journey, and we find different exposures. I'm going to tell you what these symbols are. There's a little water droplet. We talk about and notice other people that were a part of your journey. We learn about your thoughts as you went about this journey. And if ever anyone's like, I don't want to really get into that, that's fine. That's fine. We don't talk about thoughts then. We'll talk about something different. We talk about sleep that you've had at different times in your life, body composition, nutrition, symptoms, okay? How you felt at different times, other things, mediators, such as surgeries and other medications you've been on. And can you see what we're doing here? We're kind of doing like a fast play of, yeah, this journey, but I can even think about that individualized tree. And we say, awesome. Oh, cool. I'm seeing where that seed was planted in the ground. And I'm looking, oh, wow, look, kids came and swung on your branches and you loved that and that totally fulfilled you. And I'm seeing, oh, okay, they built this big, waste treatment plant right by you. And I can see how you work to overcome that. I see your strengths and I be able to get this feel through, years of teaching that I have, and medical education and all this stuff. And we just kind of piece that together, personalities and what excites you. And we go through this journey. Okay. I have some notes here. I'm looking through, making sure I don't miss anything. And then we say, where are you today? And what symptoms are you having today? And we're then able to kind of get this timeline and look at habits of sleep, look at habits of thoughts, look at habits of specific nutrients. I'm going through these same things that I went through up here. And we're able to then look at triggers. Hey, this happened at this point, but look at these 10 years before. I mean, you all get this, right? Like being in sports, being in interactions with other people, being in art, being in architecture, and you can even think of structural integrity, right? Like it's not that last step that, shattered that tibia from running. It was the 3 months of improper footwear or the trail running or improper nutrition that finally just hit. And so we're able to look at that whole history, okay? So give a little quick example of a story, okay? Once upon a time, no. So when I was in practice and all, age group and male, female, that's all kind of jumbled, so there's no patient identifiers here. But an individual came to me and he had type 2 diabetes and he was on two medications. And when I met with him, he was like, A1C was high enough, like 8.5. And I was like, well, we could add a third medication, but I think at this point with what's going on, we might need to add insulin. And he's like, don't you say that word. I will not go on insulin. And there was like fire in his eyes. I was like, would you like to look at lifestyle factors and start to modify them and work together in a holistic approach to start addressing this insulin resistance? He's like, let's go. And so we were able to then look at his individual tree and look for a couple high yield, moving the needle points and to start adjusting. That's the other thing with individual psychology and people is sure, a doc, myself, or someone can say, here's a book of 50,000 things to do, and this is evidence-based to improve this. And you look at it and it's overwhelming. It's like, that doesn't work. And that's like a coaching principle that we do manageable steps and we celebrate successes and we work towards this health goal. Well, this individual is a little faster where he's like, give it to me. And we gave him a few things. And that next appointment, there was like light in his eyes. And he came back with a binder of recipes that he had found and made, this binder of and had created, and had specific things that he was doing to improve. And it was kind of a no-brainer to me because I also knew some of his biology with labs and stuff. But within 3 months, his A1C was like super low. And we started able to peel back not only diabetes medications, but blood pressure medications. And he was elated. He was like a new person, new life had been breathed into him. And it's very enabling, empowering. And that was an experience with taking his systems biology, his genetic expression, his individualization, and saying, where are you today? And where do you want to go? Does that make sense? So that was super fun. So um, let's see, just a second. There's, I think, um, if there's a little more that we could talk about. I'm not going to draw it all up, um, but I'm going to kind of teach about it with this. And this is just to bring in the same point. Um, Sometimes there's many imbalances along this lifestyle and toxins, mold, GI health, mental health. There's a lot of conditions or imbalances that can cause one condition. And we can say insulin resistance. Um, and that insulin resistance can be then diagnosed and say, all right, on metformin, oh, on insulin, like focused on. But what's kind of helpful to also see is that that imbalance and that one condition then has one in like many other things that it affects. Insulin resistance can cause inflammation. Insulin resistance can cause diabetes. It can cause arthritis, and there can be cancers, and there can be dementia. And so if we just hyper focus on this insulin resistance or type 2 diabetes, we may miss some of that long term. And this comes to an example with heart disease. A lot of times when someone, I got to take a big deep breath. I get excited when I talk. There's some conditions like heart disease that we get super focused on a statin. Yes, huge randomized double-blind controlled trials show statins can decrease the risk of heart disease. 220 people need to take it to prevent one heart attack. It decreases the risk by 1 to 2%. There's some evidence. But if we work downstream more, upstream earlier on, we can see the lifestyle factors and improve that and improve all these other conditions that may happen downstream too. I hope that makes sense. If it doesn't, I can word it in a different way. I wanted to throw that in because it was just a fun thing, but I might have muddled it just slightly. So lastly, I want to kind of get into a little visualization and bridge to the next steps. So some may be wondering, well, what does this look like for me? Like, here I am, now what? And I would like to offer you functional medicine, offer you an opportunity to work. Here is a guide, someone, and I really like this imagery, someone just sitting next to you on that rock, okay? On your journey of life, and you've had all these experiences, and you're sitting there looking at your current symptoms saying, I would like a guide. I would like to know what path here to take. I would like to know what's right for me, my individualized tree, my individualized health, and what does it look like? What does it look like moving forward? And just sit with you to learn about you and learn about this, what helped create you, and to know what it looks like moving forward. And I'd invite you, if you're interested, just even to close your eyes and visualize that. Visualize someone sitting with you, hearing about your life story, celebrating successes. And yes, we celebrate successes because you are incredible and you value life and you value yourself and you value your journey and you have worked hard on your journey and you've learned so much and you've helped many people. And to be able to sit there and hear that from you is inspiring. And I wish the world could hear your story. But visualize being able to tell your story, and also difficult times, and also things that kind of you had no control of, accidents and surgeries and other things that have happened, and being able to share that data, that information, that you, and then visualize looking in the vista and saying, wow, there is an opportunity to create. There's an opportunity to envision, and an opportunity to choose where it is that we want to move forward to. And then what we do, and you can open your eyes if you want, I do, then what we do is that's the learning process. And then we choose. We choose our path that we want to next move. And we choose what to track so we can make sure we know if we're on the right path. We can make sure, are we in alignment with what it is that we're hoping to achieve? And periodically we review. We may recheck labs. We may, obviously we're going to meet back and we're going to review. Hey, has this been what we're hoping? What is it that we were looking for? And has this been it? And then we're able to what? Learn again. And we choose again. And we track again and we review. And this is the cycle that I go through as a functional medicine provider with patients, is the LCTR: learn, choose, track, and review, so that we can continue to evaluate our process. Because as you know, health is a big deal, and we hope certain things move the needle. We hope that doing certain things will, change these decades of experience and, influence on that tree. And there are some things that can move the needle a little more than others. And that's where we get to work together. So my invitation to you, and Savannah, if you could be so kind as to drop the link, is to schedule a free consultation, a discovery session, where we're able to just kind of hear a little bit about your current symptoms and what you hope for, and maybe what you've tried, and just see if there's a good linking of, yeah, let's work together. Let's have that the initial consult where we sit together and we sit and learn, and I get to hear your big experience. And I treasure the opportunity to be a physician. I treasure the opportunity to learn about your experiences. I am inspired by my patients deeply, and know that you have a story, and know that you have a story that, as we get to discuss it, there will be these times where you'll be like, I am good at that. You're like, I am way good at that. And I want to keep doing that and using those strengths that you have. You think of little kids swinging on the little young branches, and now there may be these limbs that are really strong because they've allowed to swinging on branches. And you want to continue to allow that, and how we can cultivate that. So again, I invite you to click that link to schedule your discovery call. I would be honored to be with you and to learn a little more of your story, and then we can learn how to walk on this step. There's a couple things that people are like, oh, but what about this? What about this? One is time. Some individuals say, I don't have 15 minutes or an hour and a half to sit with you and really talk. And there's a little bit of math that we can do. 8 hours of work, 8 hours of sleep, 8 hours extra in a day. And putting that into a week, we've got about 72 hours per week. Putting that into a month, we've got 313 hours. Putting that into a year, we have 3,700 extra hours in a year to devote time to something. And the question is, do I want to sit with someone and really reflect and see what's gotten me to that point, positive or uh, difficult or detrimental, and learning what it is looking forward and creating that new vision with someone that's experienced in helping cultivate and personalize crafting a new trajectory. Other people say, there's money, like this is difficult for me to pay out of pocket and not do insurance. And sometimes it's helpful to just reflect on, what if not? What if I don't change the trajectory or slightly improve the trajectory of my health? There are not only lost opportunities with our health, but also additional expenses with, and we're going drastic here, but I mean like heart transplants or stents, surgeries, new health medical devices, durable medical equipment. There's these things that are expenses that if we can change that trajectory, we can delay different failings. We can delay some of those things that would cause even more expenses for us. And so it's an investment. It's an investment opportunity to say, yes, I want to invest in my health. I want to invest in the opportunity to learn and grow and take this, whole person approach. Some other objections are, labs are scared about labs, or I have to go to a different place to get labs. Well, we've got an amazing phlebotomist that is absolutely phenomenal. The patient she has multiple years in functional medicine and as a phlebotomist and has an incredibly steady hand. The last doc that she worked with said that she could get blood from she said a dead person. That sounds kind of morbid, but basically she can get blood from anyone. And so, like, to be able to come here and get, thanks, Savannah, to be able to come in and you get labs here. And then the other thing is we do functional medicine labs. We can see what kind of bacteria, good and detrimental, are in your gut. And then we can curate a food plan, probiotic plan, lifestyle plan to help feed the commensal helpful bacteria and to not feed the bacteria that's not helping you. Yeah, I could totally get off on gut microbiome, but I won't. And then some other things, some people are like, well, what about a primary care provider? Like, I'm going to see you and then talk with them, and I can be your primary care provider. That's my background. I'm a board certified family medicine provider. So if that's something that you really want to just kind of keep things under one house, under one roof, that's fine. That's an opportunity. But again, I encourage you to just click that link for a discovery call so that you're able to then have that moment individualized with me, a Zoom call that we're able to really talk and hear your health journey, and get to know you a little bit more in that realm, in that vein, and then make these next steps. It's been an honor to be with you. I want to be respectful of your time. Thank you for these 30 minutes. I value you and what you're doing. And if you can stay on, I'm going to pump you up just a little bit. You're making big differences in the world. And individual connections with people, whether it's having coffee with a friend and just listening, whether it's helping a new employee, whether it's helping build something for other people to be rejuvenated and renewed. You're making a difference, and I want to personally thank you. So go out and have an amazing day. Schedule that discovery call. There's the link. Can't wait to be with you and help you on your health journey here at Trails to Health. Make it an amazing day. If there's any questions, please drop them in chat. I'm happy to stay on and answer just a couple more. Thank you, Joe and Sherry. So good having you here. My pleasure. And if there's any other questions, I'll stick on just for a little bit more. It was super fun being with you today. And thank you again for your involvement. I'm not seeing any questions. So with that, I will bid you farewell and look forward to communicating again soon. Have a blessed day.